October is Breast Cancer Awareness Month, a time to spread understanding about detecting and treating what is currently the most common form of cancer worldwide. While in high-income countries, breast cancer has a good prognosis, especially when detected early, in sub-Saharan Africa, survival is considerably lower. In fact, according to the World Health Organization, about half of all women diagnosed with the disease in sub-Saharan Africa die within 5 years. That compares to just 10% in the United States. Well, to tell us more about combating breast cancer on the continent, we're joined by Jean-Bosco Ndihokubwayo, the World Health Organization's representative to Chad. Thank you so much for joining us, sir. Can you start by telling us more about the prevalence of breast cancer in sub-Saharan Africa and perhaps which countries are the most impacted?
You know, I would like to focus on what is going on in Chad in terms of prevention and the fight against breast cancer and cancer in general. Yes, what I would like to say, first of all, here in Chad, I would like to say that the access to health care against cancer is still at its early and embryonic stage, because the country does not have a dedicated department and a dedicated unit care against cancer. Diagnosed patients are usually referred to outside countries where they can access the treatment. But what I can say also is that this country has a plan to build a national center treatment of cancer. That's what we can say in terms of access to treatment. In terms of frequency, what I would like really to highlight here is that a country like Chad has very limited data on breast cancer and the cancer in general. This is very normal because the technology to diagnose breast cancer and other cancers is still very limited in a few hospitals in N'Djamena.
You were saying that women in Chad often, because there's no way to treat cancer within the country, have to travel outside for treatment. And I'm wondering if that's accessible to most people and what some of the financial obstacles potentially are.
Of course, this is a problem because, you know, when we are diagnosed with cancer in many sub-Saharan African countries, of course, many of the countries like Chad, they do not have access to treatment. Some who have enough means in terms of funding, they can be referred outside the country, but others also can access a little bit to some surgical treatment of breast cancer here in the country, and some can bring in some chemotherapy treatment that can be provided by some doctors. But all this is not really very well organized, as I was saying at the beginning. It's just at its embryonic stage, at its very early stage. But what I like here is that the country has a vision, has a plan, and has a political will to really fight against cancer.
And for women who are maybe at home and can't access treatment, do you have any advice for ways, things that they could do to perhaps prevent cancer and protect themselves, such as screening from home?
Of course, yes. You know, when we launched this Pink October, it was an opportunity to remind to the women that breast cancer can be really auto-diagnosed by what we call self-palpation. And also for those who are very lucky, who can access mammography, they can do it. They can do mammography, every 2 years from 15 years old and beyond. You know, that information has really to be disseminated to the women so that they can know that they can breast cancer by mammography. Very few, of course, because mammography exists also only in the capital city, N'Djamena, and not in the provinces. And this means, can be really used to diagnose cancer at the early stage. That's information we have to disseminate to the women especially.
Okay, Jean-Bosco Ndihokubwayo, we are going to have to leave it there. I apologize again for the confusion over the connection issues, but thank you so much for telling us about the situation regarding cancer in Chad. It does sound very promising. Thank you very much for joining us.